This vaccine is used to help prevent infection from the hepatitis B virus, which can cause serious problems including liver failure, long-term hepatitis B infection, cirrhosis, and liver cancer. Preventing infection can prevent these problems. The vaccine is recommended for people of all ages, especially those at an increased risk of getting the infection. Some of these high-risk groups include healthcare personnel, lab workers who handle blood and patient specimens, police, fire and emergency medical personnel who give first aid treatment, hemophiliacs, dialysis patients, people who live with or spend much time with people with long-term hepatitis B infections, people with multiple sex partners, men who have sex with men, sex workers, injection drug abusers, and people traveling to high-risk areas. The vaccine works by helping the body produce immunity that will prevent you from getting infection from hepatitis B virus. It does not protect you from other virus infections. Vaccines may not fully protect everyone who receives them. Before you receive the Engerix-B adult vial vaccine, make sure to read all the information provided by your healthcare professional. If you have any questions, don't hesitate to ask. This vaccine is typically given as an injection into a muscle, such as the shoulder or thigh, by a healthcare professional. In some cases, it may be injected under the skin if you have a bleeding disorder. Your healthcare professional will provide you with a vaccination schedule, usually consisting of 2 to 4 injections, which is crucial for the vaccine to be most effective. If you have a fever or illness at the time of a scheduled vaccination, your healthcare professional may choose to postpone the injection until you are feeling better. The dosage and vaccination schedule are determined based on factors such as your age, medical condition, risk of hepatitis B exposure, and the specific brand of vaccine used. If your healthcare professional believes you may have been exposed to hepatitis B at the time of your first vaccine injection, you may also receive a dose of hepatitis B immune globulin, HBIG. This provides immediate protection against the virus, but it is temporary. To ensure long-term protection, it is important to adhere to the vaccination schedule for the hepatitis B vaccine precisely. Some common side effects of Engerix-B adult vial may include pain, soreness, redness, or swelling at the injection site, fever, headache, tiredness, sore throat, nausea, diarrhea, loss of appetite, and dizziness. If any of these effects last or worsen, it's important to inform your healthcare professional promptly. Rarely, some people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears right after receiving the vaccine injection. If you have any of these symptoms, it's important to inform your healthcare professional right away. Sitting or lying down may help, as these symptoms typically don't last long. It's important to remember that this medication has been prescribed because your healthcare professional has determined that the benefits to you outweigh the risk of side effects. Many people using this medication do not experience serious side effects. While very serious allergic reactions to this drug are rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. If you notice any other effects not listed above, it's important to contact your healthcare professional for medical advice. Before receiving this vaccine, make sure to inform your healthcare professional about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It is also important to discuss your medical history, especially if you are currently ill with a fever. If you are undergoing hemodialysis, you may not respond as well to the vaccine and will need to have hepatitis B antibody levels checked yearly. In some cases, a booster shot may be necessary if antibody levels drop too low over time. Individuals with immune system disorders, such as those with HIV infection or certain types of cancer, may not produce enough antibodies to protect against hepatitis B infection. It is important to have antibody levels checked after completing the vaccine series. Older adults may also have a decreased response to the vaccine, so it is important to discuss this with your healthcare professional. If you are pregnant, the use of this vaccine should be carefully considered and discussed with your healthcare professional. Similarly, it is important to consult your healthcare professional before breastfeeding to determine if the vaccine passes into breast milk. It's important to be aware of potential drug interactions that can affect how Engerix-B adult vial works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your healthcare professional, including prescription/non-prescription drugs and herbal products. Do not make any changes to your medication dosage without your doctor's approval. Some products that may interact with this vaccine include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. You may also receive other vaccines at the same time as the hepatitis B vaccine, but they should be administered with separate syringes and at different injection sites. This will help ensure the effectiveness of each vaccine. Remember to follow your healthcare professional's guidance when it comes to vaccine administration. The Engerix-B adult vial is a vaccine that helps protect against hepatitis B. It is used in adults and children over the age of 16. The vaccine works by causing the body to produce its own protection, antibodies, against this disease. The recommended dosing schedule is 3 doses, with the second dose given 1 month after the first dose, and the third dose given 6 months after the first dose. The vaccine is typically given as an injection in the arm muscle. It is important to follow the dosing schedule provided by your healthcare provider for the vaccine to be effective. Remember to complete the full vaccine series for best protection against hepatitis B. It's important to note that like any vaccine, Engerix-B adult vial may not fully protect everyone who receives it. Your doctor may conduct lab and/or medical tests, such as hepatitis B antibody levels, while you are using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. Be sure to keep vaccine records for yourself and your children. When your children are grown, provide their records to them and their healthcare professionals to prevent unnecessary revaccinations. Make sure to receive each vaccination as scheduled and ask your healthcare provider when each dose should be received. It's important to keep track of your vaccination schedule by making a note on a calendar to help you remember. It's important to store Engerix-B adult vial in the refrigerator, but be sure not to freeze it. Keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless directed to do so. Properly discard this vaccine when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.